Hello everyone. Today I'm going to talk about abnormal vaginal bleeding, which is any bleeding that is different from your normal menstrual pattern. So this may include heavy periods, bleeding in between your periods, like irregular periods, or bleeding after having sex, or any bleeding after menopause. So the good news is that most causes are not serious and can be treated effectively. The common causes for this bleeding include hormonal changes, pregnancy-related conditions, polycystic ovary disease, fibroids in the uterus, contraception methods, certain infections, and medications. So, in women over 40, irregular bleeding is often related to hormonal changes around the menopause. So, any bleeding after menopause should always be investigated as a risk of cancer is increased in this age group. So, you should seek urgent medical attention if you have very heavy bleeding, severe abdominal pain, bleeding during pregnancy, or bleeding after menopause, or symptoms of severe anemia such as extreme tiredness, palpitation, or shortness of breath. Your doctor may recommend tests such as pregnancy test, blood test to exclude anemia, cervical smear test, ultrasound scan, and a test called hysteroscopy, which is a camera into the uterus, and biopsy from the lining of the uterus. The treatment depends upon underlying conditions and may include hormonal medications to reduce bleeding, a hormone coil called Mirena, and iron supplements to treat anemia. And sometimes you might need a surgical measure such as removal of fibroid and polyps and treating the lining of the womb called endometrial ablation. Rarely you might need a hysterectomy to treat this condition, which is removing the womb. So remember, most abnormal vaginal bleeding is treatable and you should always be assessed promptly by a healthcare professional. In the coming videos, I'll be talking about bleeding specific to the age group. So keep watching our channel. Thank you very much.